Hey, everybody. I'm Michelle Dawson, and welcome to First Bite. All right, so this week, y'all, it's Monday. Well, theoretically, it might not be Monday when you're listening to this, but it's definitely Monday morning for me. And I flew back yesterday from Feeding Matters from the first live conference that they've held in person in Phoenix, Arizona. So I'm definitely jet lagged since 2019. And I spent 2 full days and some fabulous nights with thought leaders and colleagues from different disciplines and across the globe. And while there were leaders internationally present and there were leaders nationally present, there were colleagues that are advocates and leaders at their local level, making some of the most profound impact with their patients and setting up partnerships with local regional doctors or establishing partnerships with major healthcare facilities farther away. I got to listen to Tiffany Elliott, who has an episode with us, and she set up an entire NICU to home health transition process over in Washington. And she did it on her lunch break. She did it before hours, after hours. And that's just one example of these women and men, because there was actually some men there, that have just gone above and beyond. And I know that's the theme of this week's episode is on leadership. And I'm trying, y'all, my cup is so full, my eyes are leaking. To be around colleagues that give so fully of themselves and were so present before, after, during, and year round. It was awe-inspiring. And I know I'm having awkward pauses, but it's because I'm trying to collect my thoughts, because I will be completely candid. I went to Feeding Matters with grief on my heart, because I feel like I'm watching our professional world burn. And not in a good way, but like the enemy has taken the matches and is lighting stuff up left and right. 504s are under attack. And if you're a speech pathologist trying to get a child with a pediatric feeding disorder only services in the public schools right now, and if you're one residing in one of 17 states that have signed on to sue the federal government to dismantle 504s, your patients' lives and your colleagues' livelihoods are in jeopardy. And I am not mincing words here. Most of the states are red states. Texas is leading the way. They're truly trying to dismantle 504 plans. So a quick recap. If you have a child that only has a pediatric feeding disorder and does not receive services under a pre-existing IEP, then an easy way to initiate those services for a pediatric feeding disorder are to actually set up 504 plans. 504 plans are the backbone of the American with Disabilities Act. They're the backbone of IDEA. If access to 504 plans comes under fire and we lose them, very quickly, speech therapy services in the public schools could be eradicated. It is the first domino to fall. So, this week's guest, Ashley Lopez, talks about the crucial conversations that she had, the training that she had to develop her leadership skills. But what struck me from our conversation was that she did it in the face of fear. She made the right call during challenging times because it was on her heart and on her soul to stand up Our words have weight. And I am aware of that because I talk into this microphone. Our words have weight, but our actions will be remembered after we are gone. So I implore you right now, not if you're driving or on a treadmill or doing something dangerous like listening to me while you're weed whacking. Also, if you're weed whacking, I'm really jealous because there's a ridiculous amount of snow outside still. But I implore you to take a few minutes and stop. There's a link embedded in this podcast episode directly to an ASHA page set up to protect 504 plans. Please join me and stand up and do the right thing. Now I'm quoting Anna, and I know, but do the right thing and advocate for the patients and our scope of practice and our colleagues. Because if we don't take action now, it's really hard to pick the dominoes back up. So I went to Feeding Matters with grief on my heart, and I spent all that time having my cup filled and inspired by leaders that we can be the voice of change and we can take the action. And even though I came home exhausted, and I'm totally going to take a nap after this because I'm recording a fabulous GI, Dr. Patrick Reeves, in a few hours, but I have hope. I have hope because we are stronger than the hate out there. So take a stand, stand with me, lean into your leadership skills, join me and fight for our 504s, join me and fight for our patients and our colleagues and everything that we went to school for, because we are healers. So help us heal. And I really hope you enjoy this episode. I'm pretty sure I cry through it, but like honestly, I'm a really happy person. I just cry a lot. And then sometimes I'm a little mad. But when we get mad, we fight. So go team. But and to everybody that was at Feeding Matters that poured into me, thank you. So, y'all enjoy. All right, folks, we have quite the guest for us today, and I am incredibly honored and humbled that she's joining us. She doesn't know who I am, but I have fangirled from afar. So it's Ashley Lopez. I should probably introduce the speaker, Michelle. You've only done this 300 times before. Ashley, thank you for coming. She is a board certified clinician who also has her master's of business administration. She works a lot behind the scenes. It's one of those petite powerhouses that's involved directly in patient care, but she volunteers with the Perspectives for ASHA. Am I getting that right? Group 11.
Yes.
And she's published in the ASHA Leader as well as in Air Digestive Health. And I think my favorite thing that I just discovered is her name badge pin says, "Sorry I'm late. I was petting a dog," and we might be spirit animals. So, like, Ashley, thank you so much for coming on.
Well, thank you for having me, Michelle. It's really, it's quite an opportunity for me, and I've had an opportunity to listen to your podcast, and I'm so glad that I get to be a part of that journey with you.
Yes, well, thank you. Okay, so you're legit, folks. If you're driving and you can't see her, she's legit in scrubs, like clearly directly in between patients and her workday. So, seriously, thank you for squeezing us in. But take us from the top. I always love learning everybody's backstory. How did you become a speech pathologist? And then you've worked across the life continuum in swallowing, but there's a vast difference between a large adult swallow and a petite baby swallow. So,
Mhm.
walk us through that, please, ma'am.
Yeah, absolutely. So, one thing about me is I'm pretty decisive. And so I, for some reason, somehow at the age of 9 in third grade, decided that I wanted to be a speech language pathologist. I had no family members that know that was in speech therapy. I had a couple of classmates that would get pulled out, but I really didn't quite understand it. But I for some reason, that's what I wanted to do. And then as I got older and I researched it more, I was
Mhm.
like, yeah, this is exactly what I want to do. Um, and I got into speech therapy wanting to do auditory verbal therapy with
Oh,
cochlear implants and things of that sort. But my journey changed courses very quickly when I
that's
got into
a
grad
very
school.
that's a very different career path, honey, but yeah.
Yeah. So, I mean, I was all about that. I had done some observation hours in an audiology clinic. I had seen cochlear implant activations, and that is just next to like childbirth. I think is probably the most beautiful thing that you can witness,
Mhm.
um, especially with family members that are there because they've.
Mm,
I mean, I was only there for that 1 hour appointment, but
mhm,
their whole process of what led them to that, right? Like the
mm,
evaluations, the testings, the actual surgery, the appointments. And then so for them to finally get to that end where it's activated and the little kid looks at their mom and like lights up. It's a beautiful
mm.
thing for sure. Um so I got into grad school. I got an research assistantship with an audiologist. I always wanted to do speech therapy, but I wanted that, and so I got all of those things in place. And I took my first neuro class, and I fell in love with it. And I did my adult motor speech, and I fell even more in love with it. And then I had my adult TBI class, and then I was sold. And my dream of being an ABT therapist went away, and I wanted to do adult TBI. And
Okay.
so I did my long externship at a trauma one hospital on the trauma team and loved
Mm.
that. And a funny backstory, I ended up being a patient because I locked my knees, and when I was working with a patient and I fell, I did a log roll really, or a timber fall straight back, and I hit my head 4 times on the way down.
Oh my god.
Yeah, so
Wait, you were
um,
a grad student and had a TBI?
yeah,
Oh,
at the hospital that I was doing an externship on.
I'm
Yeah.
sorry. I just wearing a former clinic director hat, I'm just thinking that's a lot of paperwork on the director's side, and
Oh.
also, like, cannot fathom. I mean, horribly sorry about your head, but that, like, we get phone calls. Like, one time Juliana called and she's like, "Do you know anybody in Hawaii? Because my student can't get to her practicum because there's a volcano erupting." So, like, out there on the sorry, but how long were you a patient for?
Oh, thankfully I was in the ER. They did the MRI CAT scan. They're like, there's no acute bleeds, but you have to go home. You've got to get cleared by your doctor. You got to go to a neurology appointment. So I was out of like my externship for about a week and a half. But same thing, like my poor externship coordinator, she's like, this has never happened before. I don't know what we're supposed to be doing and follow the hospital's policy, if you
Mhm.
need this, here's the school policy. And then my site supervisor was like, I don't know, like, do we clear you through HR, employee health? Like, everybody was a definite learning curve for everybody for sure. But it was funny, and the one of the most the vivid story that I have, and what everybody says if they're waking up for anesthesia, or God forbid they're waking up from a coma, but was hearing voices right before I came to, because I did pass out. And I could hear just talking, and then I woke up, or my vision finally came to, and one of the trauma doctors was standing over me, and she was doing the Glasgow coma scale on me. It was so funny, and she was like, she's a GCS of, I couldn't tell you what I was. But then I was like, I just remember looking at her and going, did I pass? and and so and they did the whole spinal check and everything, and they're like, okay, get up, like, are you okay? And then I immediately started throwing up, and they're like,
Oh
and
my
we're getting
god.
a wheelchair and you're going to the
Yeah.
so it was funny because I the patient that I was working with was a TBI patient, and he was a severe TBI patient.
Mm.
And we were, problem solving, reasoning, safety awareness, all of that. And I remember my supervisor came with me to she was with me in the ED, but she was there after I got out of my CT scan, and she said, the patient asked if you were okay.
Oh,
And I was like, well, there it is, situational awareness. You knew something was wrong. So I guess I did my job for the day. But that was quite funny. She's like, he asked if you were okay.
I
Um,
love
so,
that.
and there was chocolate pudding all over my scrubs, I remember. And like a
Oh,
nurse came and like gave me her scrubs that she keeps in her locker. Like it was just a really nice experience, obviously very humiliating and traumatizing, but I just remember everyone kind of just like coming around me and helping. And I was like, this is what I want to do. Right. And so I did my CF in a post acute inpatient TBI uh, clinic in Galveston Island. And so I was on an island and a beach. So that was really fun.
that's amazing. Wait, did you live there too? Did you like treat patients, go walk the beach to decompress afterwards? Because that's
So part of
you're
that therapy was community reentry. So we were on the beach, we were on the Strand. If you've ever been to Galveston, like we did stuff on the Strand. We did like it was fun. It was a really fun place to do um, my CF. And I finished my CF, and I was like, well, I like post acute inpatient rehab, but I want to go back to acute care.
Mhm.
Um, so moved to Central Texas, and I was in a trauma one hospital. I did that, and then fell in love, moved again, went to
Mhm.
Houston and got into TBIs and all of that. And then I wanted something new. I wanted a challenge, and I decided to take a leap of faith and go into LTAC, which everyone is like, that's, LTAC's not fun. LTAC can be sad, or LTAC is just a lot of
Yeah.
waiting, sitting around and waiting. I happened to have a really great experience, and I got to find my love of TBI because we had the severe TBIs, the ones that were in coma, like disorders of consciousness. So I learned that. And then with that, I saw the patients for long periods of time from intubation to trach to eating and drinking. So I
Yeah.
really liked swallowing. And that's when I really, really liked it when I got into LTAC. And of course, I had always done swallowing beforehand, and
Yeah.
that was interesting. But that was when I really took that step and went all in. So
Yeah.
I think that's what now, 3 career pivots: AVT, TBI, now I was in dysphagia. Um, which leads me to my 4th career pivot was I've done that. I want to continue to challenge myself. Um, I started wanting to be more in leadership. And so I went back to school and got my MBA and went into being a rehab manager. And I liked that, and challenged in different ways, got to do a lot more project development and streamlining and
Mhm.
service line efficiency. All of that stuff was really fun and got my gears turning. And then my husband got a unexpectedly quick transfer. We were on a 3-year plan, and it turned into a 3-month plan of transferring, all the while we had 3 months to move. 2.5 hours. It wasn't crazy. We weren't moving across the country, but you might as well if you're in Texas. It's
Yeah.
across the country.
Yeah.
um,
Texas is huge.
and so within those 3 months, we had our second child. We sold a house. We bought a house. We moved. I tried to find myself again in a new city of like restarting, right?
Yeah.
And also dealing with all that is of a newborn, and then a 5-year old that's neurodiverse. And then where am I in that? And so it was quite a dark year for me. And I will say that I never thought I would ever be that. And I was like, I've done so many things. I'm so resilient. And then postpartum depression hits you, and you're like,
Ah,
whoa, I
yeah.
am I am not
Not
what I
okay.
used to be. I don't know how to be who I am. I can't keep it together. And so it was challenging, but working through that and then saying, like, I need part of it was I was so established and I was confident in the person that I was. And then having all of that change all at once, the only thing that I took with me was my career, in the sense
Mhm.
of, obviously my family came with me, but like we were a different family than we were, right? We were now a family of 4 versus a family of 3. We're in a new house, a new supermarket, a new post office, right? Like new schools, all of those things all at once. And then um decided, like, well, if my career really, I that's really part of my identity. That's the biggest part of my identity of who I am and who I want to be. Um, what can I do for myself? And
Mhm.
so I said, I can continue to learn and I continue to be a better therapist. And so I said, I'm going to take another leap of faith and I'm going to go into pediatrics. And even though I have a degree that says I can do pediatrics, does not mean that I am ready and clinically. And even though I possess a great fund of knowledge in adult critical care and dysphagia and neurology, um, it is a great jumping off point for
Mhm.
pediatrics. It's a great way to reason, but it's a challenge, and it's actually quite a
Yeah.
bigger of a challenge than I thought it would be, which is not a bad thing. But it has been quite humbling for sure.
Peds is
Because
a
it's
wild animal, man.
Yeah. I think, and it just goes that I like to have a rebirth, and I think everybody wants something new and taking it. But that's one of the best things about our career is that we do have a spectrum in which we can practice in.
Mhm.
And I have always been a proponent of, you don't have to do things the way that somebody else has done it. You can do it the way you want to do it.
Mhm.
And some people say you should start in pediatrics and then go to adults. Some people say you should go to adults and then go back to pediatrics. There's no research that tells you one way or the other. As long as you do it with critical thinking, with pause to make sure you are doing things safely, and you are relying on the research and not on the because that's how we've always done it,
Mhm.
and you continue to enrich yourself, both in continuing education and in your tribe and your networks, and you can do anything.
Yes. Oh, good Lord. You're amazing.
Yeah.
Okay. So, couple of thoughts. One that you touched on is that you're postpartum.
Hmm.
And I want to thank you for your bravery for speaking out on that because I had horrible postpartum anxiety. I mean, I have anxiety at baseline. Tis an understatement, but uh, my postpartum was terrible anxiety. And I will never forget, I was actually at a patient's house. I didn't have the luxury of being able to take off long after both kids were born. It was pretty impactful on our budget that mommy go back to work as soon as possible. So I only had 6, 7 weeks. And then I was back at work. But we'll never forget when I went back after Goose was born, one of the interpreters I was working with it was at a patient's house, and the interpreter leaned over and she said something quickly to the mom, and the mom got up and went and got soup for me. And there I am there to work with their toddler, right? And so she brought back soup, and then the interpreter was like, "Today we're not doing therapy. Today is you. Talk to us about your postpartum anxiety." And here I am in South Carolina, West Columbia, South Carolina. I can like I know they're right off Sunset and I'm sorry,
Hmm.
it's the Boulevard. It's a huge major intersection. And there's this mom and this interpreter loving on me. I am 2 states away from all family. And they gave me this space to fall apart and acknowledge that it's not baby blues. The depths of that isolation, the depths of that abyss, right?
it gave me a chance to not be a therapist, but first just be a human. And y'all, if you're listening and you take nothing else away from our talk, please take away the fact that if you want to best serve those that have been brought into our world, you have to take care of yourself first. And mental health matters. And postpartum depression and anxiety can just suck it because they're bloody awful. And we should do a better job of taking care of our new caregivers. But yeah, there's very, very big soapbox, but thank you, thank you, thank you for sharing it. But oh my God, I love that woman. Both of those women just loved on me, and they made it was a red bean soup. And oh my God, I tooted the entire afternoon for the rest of the day. But it was so good. And also, after having recently had a colonoscopy, I now know why red beans do that to me. So go team for getting your colonoscopy at 40. But it is there's also biasy between the adult camp and the peds camp. Have you ever noticed that where one views itself as superior and there's like this alpha attitude of like, I'm more diehard than you are. And I'm like, oh no, it's all really hard. Like, let's let that ego trip go. They're equally difficult. But it's how do we grow and learn and lift up one another to break down the barriers so that we can have more enter into that sphere of swallowing. Yeah.
Yeah, it's so funny. I'm going to bring in a real experience that just happened to me last night. So I watched the Grammys and I was like, oh, Beyonce got Country Album of the Year. Great. I didn't stay up till the end. I did watch the headlines when I woke up in the morning. So I know she also got Album of the Year. But she, in her acceptance speech, she said, genres are just barriers that we put up for each other.
Yes.
And we we can be anything that we want. It's our artistry. And I was like, that's exactly how it is, right? Like we put in this, like you said, adult camp, PD camp, and we do that for whatever multitude of wrong reasons of why we do that. Um, and I will be the first one to ask why, because we all have the same standards that ASHA gives us within our
Mhm.
graduate programs that we all have to fulfill. We all have to
Mhm.
fulfill the same CF. Like we but we choose what we want to do with the training, the experiences, the
Mhm.
continuing education that we decide we want um,
Mhm.
to pursue, and or what our jobs give us, right?
Mhm.
And so I will say that I did get a lot of resistance of why do you want to do that? Um, your knowledge and experience is not necessarily at the level that you need for pediatrics, even though. And so I was, that was also really hard. I was, when I transitioned to this position, I was definitely on the up and in recovering and kind of settling all the dust. And so it was still a big hit to my heart and to my head because I was like, I'm smart and I'm capable and I'm confident that I can do this. And I
Mhm.
just need you to crack that door open. And I promise you, I will kick it, the rest of it open. Like, I don't need you to hand hold me. I don't need you to walk me through everything. Like, I will take your information, I will apply it, and I
Yeah.
will learn and be a great clinician that I know that I am and can be.
Yeah.
Right? I just need that opportunity. And so, in kind of reaching out to different people of like, hey, what should I do? What are the better courses? Or if, what kind of pathway should I go towards? I mean, there's definitely tons of recommendations. And Michelle, you were one of the ones that I reached out to, and I was like, I found your podcast and it's helped me kind of find a voice or even just a network. And so, I mean, I did reach out to you probably, I wouldn't say in the deepest, darkest part of my episode, but it was definitely dark for sure. And so you were so nice and you were like, well, keep listening and thank you so much, because I moved. So my colleagues, my friends were all back home, and so
Same.
nobody to share war stories with, and um, it was a very lonely time. And so podcasts were great because it was like, okay, I got this. And then, I read your book and I was like, that all makes sense. Like I can, you know, I can apply that and that makes sense. And I can't forget to not think about these things. And like, it was very much a amazing blueprint for me to open up my mind to a different way of thinking for pediatrics, where you kind of have to think more, um,
Holistically.
I would say longitudinally, right? Because in adults it's like the here and now, right? Like
Mhm.
they have what they have, whatever, whatever, but then it's like the possibility of this child and their growth of the child and the opportunities that we're providing through this intervention. And so that was a big shift for me in thinking. And I'm still learning. Would not say I am anywhere near where I want to be, and lots of
Nor am
things
I.
to do. But, you know, being on a pediatric team and kind of really starting from the beginning again, um, is different. And I will say, even the team was kind of like, the team is like, well, we starting from the beginning is usually like starting with a CF or starting with somebody who's not quite as tenured. But they even had to take a step back and say, you do have critical thinking skills. You do have the ability to read an article and apply it. It was, they had to change their teaching processes too,
Yeah.
because it was like, we teach to this kind of audience, but you're a different audience we haven't had an experience with. And so I think it was good because we were both kind of navigating uncharted waters together in different ways. I was definitely in a small boat and they were probably on a yacht. But, we were, I wanted to learn and they were learning how to mentor and train a different type of clinician, a clinician who's
An
more
adult learner.
confident. Yeah.
Yes. Teaching Jennifer Castex out of Arizona. Do you know her?
Mm-mm, no.
She's bloody brilliant. Also probably throws the biggest Mardi Gras festival in Arizona. She's she moved it, so she took it with her, right? But uh, Jennifer is one of her strengths is talking about how do we mentor as an adult learner. And she's been on the pediatric feeding and swallowing disorders committee for ASHA for like the last two, maybe three conventions. And she did a talk all about teaching adult learners, and from the perspective of how do we engage with caregivers, but how do we also engage with colleagues. And it every time she talks, every time I see her present, it reminds me how to shift my interaction styles when I'm learning so that I can convey what I need from a speaker, from a course, from a topic, but also in turn, how do I do that? Does that make sense? Um,
Yeah, it does. Yeah.
yeah, yeah,
It's
yeah, but she's been on the podcast in the past. But I just, God, it's so there is an art there, and knowing that you are involved in supervision and MBA and leadership, there is an art that's a skill that if one doesn't have, one can pursue mentorship trainings, teachings, and in order to get it. But yeah, my ADD is showing. I got very excited and squirreled.
No, well, we definitely need to probably reference that episode because I would like to listen to it for sure.
Yeah. Wait, what made you go back and get an MBA?
So I went back and got my MBA in the fall of 2020.
Oh dear
Um,
God! In the middle of the pandemic.
well, yeah, I was going to say, y'all know
Look
what
at you
happened in
going.
2020.
Yeah.
Um, so New York obviously was the mecca of COVID outbreak and kind of doing that. Houston, Texas was the second um, hotspot in the United States. And so that's where I was. And thankfully, right, or I guess fortunately, we had the benefit of time. Everything that New York was experiencing, we experienced it 2 weeks later,
Okay.
right? And so we could learn about what they were doing. And so I was very much in tuned, and my hospital system was very much in tuned. And I don't know, it's all I ever knew. And so I don't know if it's weird or if it's not uncommon, but in Houston, there's the Texas Medical Center. And so there's lots of different hospital systems within that area, within a 4 to 5 mile area. You have
Okay.
pediatric hospitals, specialty cancer hospitals, neurology hospitals, general hospitals, trauma hospitals, everything. And during COVID, they all got together. Like all the CEOs and presidents got together and they said, what do we need in order to care for these patients that are coming, no matter if we're ready or not? And that was one of the things that was really interesting because it was like your competition is
But
now
not
your
yet.
friend.
Yeah.
Yeah, is now your friend. And so, long story short, they all coalesced and they bought things in bulk from
Nice.
the right. So instead of buying 1 million of whatever, they bought 70 million, right? So we did not experience the shortages of PPE that other hospitals had. And
Mm.
that was a very real thing for a lot of people. That scared a lot of people. And so, just within from March to like June, I saw all of that within my manager who kind of let me see it because for
Yeah.
when he saw the anxiety in me, I'm like, because I also was the only early on in the pandemic, they didn't dismiss them, but they put all PRN staff on hold. So I
Okay.
was the only full-time speech therapist in my LTAC. And then I relied on a group of 3 PRNs to help me. And then I went from no help, the only SLP in the building. We went from a census of 50 to 150. And
Oh,
guess
yeah.
what? Everybody's coughing. Everybody has respiratories, right? So,
Everybody's got dysphagia.
yeah. So, I was like, well, how do I be efficient? How do I triage? How do I do these things? How do I make sure that I keep myself safe? How do I fact check? How do I trust and verify and also keep up with the everyday changes of this is the policy, no wait, this is not the policy anymore, this is now the process? And because we were all learning in real time, and so that was kind of where I was like, I like this, I like this problem solving, I like seeing the machine of medicine. And some people maybe don't, but I liked it. And so I was like, well, I want to do that. So I applied and got into MBA school, and it was a online program that was expedited. I think, I don't know the word is. It was fast. It was a fast tracked MBA, and so they said you could give it in as little as 14 months or as much as 24 months, and I ended up completing it, I think, in 16 or 18 months. And that's because I slowed down because I started studying for my board certification test. So I took, only one class as opposed to two or three. And so, but I liked it. I got to learn the finance terms, the accounting measures, the operational efficiencies, and like there was a lot of leadership in it as well. And so it helped me understand the world more
Yeah.
because I was so into the patient care, but there's a whole city of that goes into what I do that a lot of us in medical care don't really know or see or have just the
Background
mindfulness
knowledge.
of it, of
Yeah.
like there's so many people that help you get this thickened liquid to the bedside, right? Like who orders it, who's stocking it, who's providing the budget for it,
Yeah.
who's overseeing,
Yeah.
you know, to just do that. And so I was like, I am a small speck of sand in a huge beach. And I was like, I want to do this. And so I did have a great manager that kind of allowed me in on that and wasn't threatened of like, you want to take my job. It was more of like, you want to learn? Come on in, you know? And I appreciated that opportunity. I appreciated him more because I was like, oh, you deal with a lot. I'm just mad because you told me I had to see 8 patients today, but there's a reason why you told me to see 8 patients because there's X, Y, and Z, right? And so it made a lot more sense to me. And it still does. And it helps me in feedback when I'm working with team members of like, they're like, I don't understand. Well, let me walk you through this part of the reason, and then there's this part of the reason. It's your impact on patient care, but then there's also we have to sustain our clinic to be able to provide patient care, right? Like it's a two-part process, and as therapists, we definitely are in the first part of it, but it requires both. So I think I've been able to be a good leader in that when they question, they ask why, I can give them the reason as opposed to, well, that's just what administration told me to do, right? And
Yes.
so, or that's just the new directive that came down the pipeline, and that's what I'm doing, right? And to give them well, it's because we didn't meet budget, and it's because we're at this, and if they forecast that if we do this, we can right side the ship, and there will be no layoffs, or we will be able to have our quarterly bonus, or we'll be able to do these things. And so they're like, oh, okay, that's cool. So yeah, that was a big tangent, but that's really why. And so I finished my MBA in May of 2022, and I got my board certification in April of 2022.
That's a very big year. There's a lot of undertakings. Yeah.
Mm.
I got to be honest. I've toyed with going back. I love the advocacy work so much. I love the policy change, but like statewide policy improvement. Personally, I've toyed with going back and getting a master's in public health
Mm.
because that aligns with all of the volunteer work that I do. Um, just want somebody to pay for it. There's that.
Yeah, there is that. I lucked out, and that it was COVID, and there was a lot of grants.
Correct.
So and then obviously I had some employee sponsorship because I was a full-time employee. They were like, "We'll pay for this much every year," and so I ended up making it out with not too bad of a bill. But
Yeah.
it was very circumstantial. I don't think it would if I started it today, it would be the same.
Yes. No, but all of this goes back to a common thread of clinically, we are never trained for this. Graduate programs are beholden to Council of Academic Accreditation. They are beholden to maintaining and meeting those standards set by CAA, as well as whatever graduate regional accreditation that university has, right? Like, because there's different regions in the pockets. That's the business side of grad school. But because of that, students rarely get the opportunity to have exposure and experience with, if you want to go into public schools and understanding educational leadership. All of those behind the scenes stuffs are maybe tiptoed around, but not, our speech babies aren't equipped. And I feel like our speech babies and our colleagues having that information allows us to, just as you explained, grow within the system, but help with functional process improvements. When we identify breakdowns within whatever respective work system that a clinician may work in, being able to give a functional resolution. And that's leadership training and coursework. God, it's key. And that's lifelong. It doesn't just end. I mean, I did the Ashley Leadership Development Program years ago, and I was like, cool, I know a thing. And then I got more involved with our state association, and I was like, I don't know diddly squat. It's like, these are really good theories, but it turns out this only works if my lobbyist knows this senator and they know that that senator made bad choices in this arena, and we're going to, like, what is that about? Like, there's, a whole nother
And
squirrel nose there.
it's true. And I've done research like veterinarians, doctors, nurses, and even physical therapists have business built into their programs.
Orchids. Yeah.
And we don't.
I feel like veterinarians make some sense just because veterinarians almost always own their own private practice. Like, you know what I mean? Well, I guess it's a private practice. I don't mean like it's a vet office. That would be a private practice. Yeah.
But like, yes, it's essentially a private practice, but they know what it takes to run a business. They know at the end of the day, we have to be viable. And I think we do a really great job of teaching the heart, but we forget about the business part.
My husband color codes the Excel spreadsheets in hopes that it brings more attention for me looking at the family budget. So
That's so
like,
funny. I listened to your podcast. I forgot what episode it was, but you were like, "Isn't it weird how speech therapists always like marry like engineers or
yes,
accountants or like?"
yes, that brain. Did you? Please tell me you did.
I was cracking up because I was like, "She knows my life." Like, I I have a budget on a spreadsheet that I roll my eyes at every month, and my accountant husband insists that I learn it, and he's like, "You have an MBA, you know what this looks like," and I'm like, "Doesn't mean I agree with it."
Don't
So
like that bottom number.
it's so funny though. But yeah, I remember that, and I was driving and I was cracking up because I was like, "It's true, it's so true."
It's so true. Yes, but we do. It brings the balance. Like, I just don't. Our worlds are so different. Like, bless his heart, he makes things blow up or not blow up, and if they blow up, it's been a bad day if they weren't supposed to blow up, and you can't really talk about it because security clearances, right? But like, he's like, "What did you do today?" And I'm like, "Well, I taught a little girl not to be afraid of her dragon cape, and I pretended to be a dragon flying around the clinic, going, 'I'm going to eat you.'" I'm like, and this is what I have a master's degree for. But like, the amount of attunement, attachment, child-led play, clinician play, like gestalt scripting, and then, oh, by the way, we're talking about eat vocab in like this fun dynamic setting. Like, I know all of that stuff, but it's the rubber meets the road. I also know we have attendance policies in a private practice because we cannot afford to maintain a private practice if you have so many no-shows or so many cancellations and you can't fill the slot, because how else are we going to afford health insurance, life insurance policies, keep the lights on, and it finally melted, but we've had snow and ice here for weeks. So everybody's attendance numbers and visit counts are down, and that's the pretty Excel spreadsheet side. On the clinical side, carryover is harder when we have those inherent barriers, because it's literally mountain roads out here, and families can't get down their driveways off the mountain, and internet might not work. I mean, it is rural in Augusta County, Virginia,
Mm.
which I'm kind of, part of me loves and part of me not so much, but we're going to figure that out. Also, we did find out that the thing eating the bird feeder is not a bear, it's a deer, and I feel safer going outside of my house now. So like, that was terrifying. But yes. So when you made this huge transition while strengthening all of these different skill sets you had, how did you make your tribe? And I will be completely honest. I literally had a moment and cried with my husband a couple weeks ago that
it's been hard to make friends, right? In our world, when your name is out there, it comes with associations, right? For better or worse. And so we moved here, and everybody expects Michelle Dawson to be put together. Michelle Dawson is a joyful hot freaking mess, and like literally wearing yoga pants with paint on them, and worried that I've said literally too many times, and now my social anxiety is going to kick in on that. But real authentic moment, it gets lonely. And when we're not from here and we moved, I struggled with, making friends and finding colleagues that I can be authentically my vulnerable, neurospicy self with. And I'm still in the world of peds, but you went from adults to peds, and with all of those challenges and working through depression, how did you do it? How did you find your tribe?
Oh, I don't think I've still done it yet, really. So I had one person that I could tell that we were moving, because it was all, because like I said, we had 3 month lean wait time, and I was on maternity leave. So how am I'm not going to say that also killed me
Mhm.
so many times of like, I'm not coming back. And I didn't get to say goodbye to my team. Like, this
Mhm.
wasn't how it was supposed to be. Um, and also I was a little bit more of a feminist of like, nobody ever comes back from their maternity leave, and here I am. I'm gonna be that person, you know. And so,
Yeah, but
and
you're that person for a valid reason. I mean, both are valid, but also, yeah.
yes, but yes, when you make the decision for your family, that is the right decision for your family.
Yes,
But
yes.
it's a real thing in any field, really, for anybody who has a child, and if they choose to concentrate on their family, and or uh, try it out and make it work, and then it doesn't work. So I will walk that back. It's not a bad thing. But I just was like, I would never be that person.
Mhm.
But yes, but we moved, and I still, um, in a whirlwind, got a job, and I was like, this is just a job because I have a new mortgage. But I leaned on that one individual, and she was the one that was like, Ashley, you're not yourself. Ashley, like, you're not yourself. Like, are you okay? Have you thought about this? And I was like, the pride, the like, no, I've been successful at everything that I do. It may take me longer than I thought it was, but if I do it, like, I can do it, like, I'll be fine. And so finally I hit a point, and it was like, specifically remember where I was, and I was like, oh, this is not good. And so I called her back, and I was like, you're right. What should I do? And she was like, well, let me walk you through this. And she's been great. And then I also have my really good speechy friend that I probably haven't seen in real life in 4 years, but I met her in my LWTP cohort. Love her to death. She's always a cheerleader, for me, and saying I can do things that I put my mind to it. So I'm like, yeah. And then I also have another colleague who actually moved back home herself. And we just like, I was like, I've never been so connected to a colleague before. And like, we just thought the same way. We had very similar experiences, like, um, in our careers, and we just kind of gelled. And so she was also a really big help for me. So all of these people were virtual, right? Like, they
Yeah,
weren't in my
yeah,
face,
yeah.
hugging me, whatever. So I did lean a lot on my husband, and kind of work through it. And I did all the things I needed to, still doing all the things I need to do, and to make me back to who I was, or close. And like what we tell people in therapy, like, for adults, like, we're going to work towards getting you as close to what to the to your goals as possible, because things have changed. You might never Your normal that you used to have may not be your new normal, right?
Yeah.
And so I really leaned into the new normal of like, this is me now. This is all of me. This hot mess express, just like kind of what you said. And so I'm okay with that. I'm okay with not being okay, but also not accepting it. In that I can work through it, I can be honest about it, and I can still be whoever I want to be. This is a part of me, and I'm not going to be ashamed about it.
Yeah. I told Christian, I was like, I feel immense guilt for feeling lonely when I have a house full of, um, well, in the moment, I was like, I feel guilty being lonely when I have a house full of like tallywhackers, right? Like I have my husband, boys, like it's just there's a house full of boys and it smells like an armpit in my house sometimes because they're just at that age where it's just like it emanates from their being and like they could take all the showers in the world. 12-year-old man cubs, they just play outside and then they walk back in the house and it's like that is a smell. But like Goose, if you're listening, I love you. You're doing great. But like it's just part of it. And he, it was he knows what we came from where literally we would walk in the house on a Friday night and I had no idea which one of the girls would be there who had popped by the house just because our house was home, right? And I'm missing that feminine touch within our home, within my friendship base, within my mentorships, within. And as you're sitting here talking about the virtual relationships, I cannot describe the immensity and comfort in this last year and a half that was poured into me by colleagues through random text messages, somebody just reaching out and saying, hey, thought about you, saw this. It was whenever I was blue, there was a glimmer, which I mean, we go to an Episcopalian church, still technically in a Lutheran church because we haven't transitioned to membership officially, but like I see God in those moments. And it's folks, I say all this because you don't have to have the answers always, but it's the act of taking care of oneself that makes you a better partner in life. It makes you a better therapist. It makes you a better leader. And for me, moving my body, huge. If I don't walk in the morning or walk in the afternoon, my ADD, I feel like the Energizer bunny that will explode. So we do a couple miles in our subdivision, which isn't hard now. It was hard in Columbia because you'd have to watch for the college kids coming home because they would get schnockered and then peel through downtown. But out here, you do have to watch out for wild dogs, which that was not something nobody told me about when we moved to the country. That's a cool thing. Although we have the world's fattest squirrel that lives in our backyard, I may or may not feed it. And so we do like to look for the squirrel. But creating those rhythms and those cycles and a gratitude journal. And Aaron and I date each other by going to TJ Maxx and we're on the phone at different stores. So like it sounds, but we would just go to TJ Maxx and smell candles. It's a basic girl thing and I know it, but like something about that act of just going to the store, but it gets me away out of smelly boyland, which my house does look like a pastel factory, but I mean, it still smells like boys. So, yeah.
Yeah, you're right. I have two boys. They're little, but two boys, and so same thing. Boys in the house, and um, we've always lived away from our families, so we've never
Yep.
really had that familiar support. Um, but I had a lot of that the feminine like tribe and support through my son's school. We all did like a
Mhm.
bunko night. We like, oh my gosh, did you get this? Um, the teacher needs us to do this. Like, oh my gosh, like we only have 2 days. Like just kind of that camaraderie of like that, and that was fun. And then I moved away, and I didn't have the bunko nights. I didn't have the let's go out and go to happy hour and things of that sort. So slowly but surely, like um meeting people, finding what I like about this new city, and finding out about
Mhm.
um the things that we can do. And so it's funny, we live in the city limits, but we live in the hills of the city limits. We have deer and fox and raccoons, and that's really that's fun for this for the boys, because it's like
Yeah.
I've never seen a real fox in my life before, and it's just sitting in my front yard looking straight at me. So that's fun. And we named the deer, and so yeah. But finding the good in the current situation, and finding being okay with the new and forgetting about the old. Like, I don't have a bunko team no more, and that's okay. But I can find something else, right? And
Yeah.
so part of it is letting go and grieving that loss, but not letting that grief affect you from, or keep you from, the new stuff, the new wonderful things that you haven't experienced yet, and can and
Mhm.
enjoy just as much as you did the old
Mhm.
stuff. And so it's kind of also the my hope in transitioning to pediatrics is I can, you know, grieve the loss of, like, and it I don't want to sound like, oh, it's like a superiority, because I was so in depth of my practice, but just so sure of myself.
Yeah.
And now I question everything. Like, did I make that decision? Like, waking up and be like, oh, should I have done that recommendation? I don't know, right? Like, and I remember that as a CF, making those comments, and I'm, making them again, and being okay with not being the mentor all the time, not being the teacher, and being the student. But that was a big thing for me too, because I was like, I mean, sometimes I'd be like, I don't learn this way. I don't want to be taught this way.
Yeah.
I this is not going to work out for me. And being confident enough to say that, whereas, when I got out of school and I was a CF, like, I would have been like, I'm just going to make it work. I'm going to do it the way that they told me to, and or I'm going to learn the way that they're teaching me, instead of now where I'm
Mhm.
respectfully pushing back and saying, like, is that the only way? Like,
Yes.
is there another alternative way? Was my decision wrong, or was it just different than
Yeah.
what you would have done? And
Yes.
being okay to ask that question, but it is also sometimes off-putting for the person who's receiving that, of like, oh,
Yeah.
and so it is like you said, an art to giving feedback to adults, and knowing your audience, and doing it, individualizing it, instead of like, I've taught a million therapists or students, and we've done it this way, and it's worked for them. Well, it doesn't work for me, and I'm going to let you know that, because I want to enjoy this,
Yeah.
and I want you to enjoy this, and I don't want it to be arduous for anyone involved.
Yes. There's a lot of difference in a typical 25-year-old's ability to communicate. Well, grad students are younger than that, 22, 23, and their ability to communicate and recognize within themselves what I need in order to grow, versus me as a 41-year-old saying, hey, this is what I need in order to grow. This is how I receive feedback. This is how I receive or I give, knowledge, content. And it's, I don't know. There's something very humbling. If you're the smartest person in the room, you have no capacity to grow up, right? So I love not being the smartest person in the room, because otherwise, where am I supposed to go? And and I have tiptoed and dabbled in academia twice as full time. And
Hmm.
both times I was miserable and couldn't breathe. Not because of the people around me, because colleagues were wonderful, but because I love treating. I love thinking clinically. I love the challenge of a new case when a new case presents. And I'm like the first person to kind of like pull it together. I'm like, I almost said the F-bomb, but like, yeah, let's figure this out. And like, it gets me so excited. And I love playing. Um, right now, the kids are really into Kids Against a Maturity. Have you read that card deck?
No.
Do not buy it for your babies until they are middle schoolers. Okay.
Okay.
And even then, it falls in the is this good parenting or is this not parenting? And then, as Goose said this weekend, it's all right, mom. I already heard it on the school bus. And I'm like, oh, again, I don't know if that's great parenting, but like, this is who I am and I love this. But we went 14 different ways on the tangent. But I say all that because I have, with the move, had the opportunity to deep dive within myself and fine tune, hey, I really like the treating side, but here's how I want to demonstrate leadership. And for me, that's how do I tithe in our state association? How do I volunteer there? How do I find the balance so I can still keep podcasting? Because this is like a passion project, right? Like interviewing and it does take a full day. Like folks behind the scenes, today is Monday, but like I record, I write, I do all the behind the scenes stuff, I recruit, and that to me is how I can share of this weird talent I have of pulling people together to do good and still find the balance to be with my patients. And I think to me, being a leader in this field means finding your rhythm and your rate and then pursuing it, right? And this is a much better rhythm and rate than what I had in South Carolina, which I'm still going 100 miles an hour and nobody should have seen me before the second cup of coffee this morning, but it's I can breathe, if that makes sense.
Yeah.
Yeah. Also, we
And you,
moved. Go ahead. No, no,
no, I
no.
was gonna say, and you just got on the board of Virginia for the speech association as well.
Yeah. Erin Clannard, if you're listening, this is all you, ma'am. I'm the new VP of speech pathology, and which has been another way to tithe because we have so many deficits with like coding and billing and reimbursement. But the prior board members were not in like in this role, were not in private practice, so they were not in the know for the things that needed to be updated, if that makes sense.
Yeah.
So coming in with that lens, it shapes what we need to advocate for patient and care and clinicians at a state level. So
Yeah, it's good. And I think it's important. And I may be an outlier, but I think in order to sustain ourselves in this career, right? Like you gotta grow and stretch into things you never thought you were going to do, or be like, I'm not interested, but at least give it the opportunity because it can take you
yes.
on a wonderful different path and you can meet so many great people on the way. And so I don't take every opportunity, um, but I do appreciate every opportunity
Mm-hmm.
for the possibility of what it will bring to me.
Mm-hmm.
And I look at that as just a whole bunch of concentric circles of like, oh, that was this part of me. This is this my group. This is that and that and that and this and that. And then at the end of the day, I'm just this wonderful polka dotted thing, and it's great. It's kind of a tangent, but and sometimes I'm not great at words. But
It's okay. We teach people to swallow. I say that all the time. You're fine.
yeah, I'm a speech therapist, but I teach people to swallow.
Yeah.
But I it's it's great to do things you never thought you could do.
Yes.
And so I again kind of drives back to, where I am in my life and why I'm doing the things that I'm doing, because I want to be a speech therapist forever and ever and ever. And it looks way different than when I decided to be a speech therapist. And that's
Yes.
okay. And I'm glad that I took all those turns, and I'm glad that I've said no to things and changed my mind, because um, I'm a great person and I'm a great therapist because of it, because of
Mhm.
all the people that taught me along the way, that were gracious to me along the way, and also for the people who were not very
Mhm.
nice to me along the way. They taught me things too, and also gave me a little bit of grit of like, I'll show you, I can do this. Um, so I
Yes.
mean, I think everybody is there for a reason.
Yes. Okay, we are over. But I have one last question, and this is me being naive. We I know you're involved in SIG 11
Mhm.
for supervision and administrators. I always thought that that was only for academia, like clinical supervisors and those. Is that like um, a public private sector as well?
That's a great question. And so I've been in and out of SIG 11 for probably about 5 years. Because same thing of like, is this what I want it to be, or is this something I'm not? And I will say it is very heavy and academic, but there are little tidbits and nuggets. And I think there's a great opportunity for SIG 13 to kind of pair up with, right? And but I have taken away from it of like the mentorship and the structuring of feedback and things of that sort, which is very um there's definitely a big light shined on it in academics, but you can translate that into clinical
Yes.
practice very easily. It's at the end of the day, it's all speech therapy. And so again, it's dive into things that you may not think are relevant to you or whatever, because you don't know what you'll learn or who you meet. So this year, I'm actually taking, um, uh, I'm actively participating in SIG 11 this year, as a reviewer for this for their SIG 11 perspectives journal. So that's really
Yeah.
cool because I like to read articles, and I
Yes.
learned that is how I learn. I like, and then so again, I'm gonna highlight your book because I was reading your book while I was training, right? And I was like, oh, that was that case. Like like, and I could pair it and I could see it. And so I learned that about myself. Like if you would ask me at 25, how do you learn? I'd be like, oh, I like hands on, like I don't, I that's not how I learn, right?
Uh-uh.
Like give me a book to read and then show it to me, and then I can tell you what you're doing and I can
Extrapolate it.
break it apart, and
Mhm.
I can fill in the dots, and then I can tell you what the next step is because of that. And so, in doing that, right? So I like reading research articles because I can bring it, I like reading books because I can bring that into my everyday life in
Yes.
one way or another and apply it. So I don't know if that does make me a visual learner, but I love to read. So is that,
Yes.
I don't know, maybe I need to go back and think about it, but
Same. If somebody tells it to me, I can't hear it. It's like I know they're saying the words and I know that it means something, but I have to I have notebooks like all over the place because I have to write it down and see it. Otherwise, it's not going to stick. And so I remember Dr. Norman one time, she works down at Francis Marion University. She's over the coursework. Like I was the coordinator for the clinic, and she was the coordinator for the coursework. And there's a title, Michelle. I'm ruining it, but her name's Michelle. But Dr. Norman was like, "You're making that face. What does that face mean?" And I was like, "Oh, that's my thinking face." And she was like, "What is happening in your brain?" And I was like, okay, I'm putting a vignette together. In order for anything that somebody says, if I can't write it down, I have to draw it in my brain or like make little cartoon characters act out whatever they're saying. And she's like, okay. It's like, that's so weird. It was like, so then like the negative self-talk, social anxiety kicked in. And I was like, what does my face look like? What face am I making? But that's like my vignette making face. So,
Yeah, I mean,
yeah.
I'm a tree killer. I'm like, do not give it to me in PDF. Do not. I need to print it,
No.
and I need to see it, and I
Yeah.
need to highlight it and write
I'll
notes.
do
And
it.
that's showing my age too. Of like, now everything's virtual and Kindles and
No.
all these
You need to
tablets and
smell a
my.
book. You can't smell a Kindle. There's no smell. What is
I
your
need to
learning
feel
experience?
the page. It's like it's an experience. It's an
Yeah,
experience. So yeah.
that's awesome. Ah. Okay, well, we have run over in the most fantastic way, and this conversation meant a lot. So, thank you.
Thank
But
you.
if somebody has mad money lying around, where can they give their love money or their mad money to?
Well, I I have to endorse the Dell Children's Foundation.
Mhm.
We are a faith based ministry, and so we do provide a ton of care to patients who don't have resources. And now more than ever, I think that we need to concentrate on everybody, our brothers and sisters, no matter where they are in their lives or in this universe, that we need to make sure that we take care of them and we give them the best shot, especially children, right? And so we, even in our clinic, I think a majority of the care that we receive or that we provide, excuse me, is non-funded. So if you have a special uh, place in your heart or even a few pennies, I would like for you to just consider Dell Children's Foundation for sure.
Yes. Awesome
Yeah.
sauce. Well, thank you. Thank you. Folks, Ashley is on LinkedIn, has a lovely profile on LinkedIn. So please feel free to take a peek. And thank you. Thank you
Yeah.
for the day.
Thank you.
Hang on one second, hon.